Health reporter Haley Hernandez is here to talk about this new proposal that has women being screened, what is it, a decade earlier, right?
Yeah, and so I really want to clarify what's new about this, right? Because people keep asking me, what is new? A lot of people have already been getting screened at 40. So the official guidelines that have been in place since 2016 say to get screened at 50 years old. But most doctors have already been encouraging women to start earlier at 40. And insurance has been covering mammograms every 1 to 2 years for women 40 and older, according to the CDC. So the new guidelines saying women need to get screened starting at 40 come from this. The U.S. Preventive Services Task Force, they released the proposed update to its breast cancer screening guidance, dropping their recommended age from 50 to 40. And specifically from Dr. Amita Vyas with George Washington University, she tells me that this new guidance is screening every other year starting at 40. And she agrees there's always been some confusion since organizations such as the American Cancer Society have already been recommending yearly screenings starting at 40. So the change from the task force reflects new data that shows a meaningful increase in breast cancer rates among that demographic, that 40 to 49-year-old demographic. And according to Dr. Natalie Azar from the Today Show, women who get breast cancer younger, it tends to be more aggressive types of cancer. So this new guidance will really reinforce to begin that screening at 40. If you've already been doing it, wonderful. You're not behind. But if you're 50 and haven't yet had a mammogram, then it is definitely time, because according to the new guidance, you're already a little bit behind.
Wow, yeah, no kidding. So there's this, it is a little confusing because you have doctors sort of, I guess in that sense, pushing the envelope or just saying, hey, you need it, let's do it. I don't care what the guidelines say.
Because they've been seeing cancer diagnosis in, 40-year-olds for a while. So my doctor told me that that's the age that I needed to start. So when I saw these new guidelines, I was like, yeah, we already know that. Yeah, right. There's a little bit of a twist that doctors have already known. It's probably best to start at 40. These are just the official new guidelines with new data about breast cancer rates in that age group.
Get everybody caught up on the same page with regard to when this is supposed to start. Haley, thanks as always. Super important. Is here with us to talk about what's so significant about May 3rd. Good morning.
Well, May 3rd, 1968 is when Dr. Denton Cooley made medical history performing the first successful transplant of a human heart. Now, that is really what put Houston on the map as a hub of medical innovation. Before that, we were an oil and gas town. Right. Now we're a medical city. Today is the 55th anniversary of that transplant, and I wanted to show you a little Houston treasure. We have video. On the first floor of the Texas Heart Institute, there's a museum. Okay. And this is really dedicated to Dr. Cooley's work. Now, I encourage a lot of people who come into town and don't know about the medical center to really take a look in there. People who come to these hospitals and they're waiting a long time in lobbies, and it's right across the street from MD Anderson. So I say, take a walk over there. You'll really learn a lot about the medical center and just Houston's history in general. So it was actually that was actually the first tour I got as a health reporter. The Texas Heart Institute invited me in, so that's how I even know that it's there. It does hold artifacts that contributed to the first transplant. Dr. Cooley was a medical pioneer. He died in 2016 in his 90s, but yesterday we spoke with the CEO of Texas Heart about how significant this is to Houston history.
But Dr. Cooley is largely recognized for being the first surgeon who actually performed the operation and got the patient out of the hospital. There was a series of transplants that occurred after that. He actually had probably the biggest series of transplant patients within about the first 4 or 5 months. But at that time, we didn't have the kinds of medicines that we use today to lower the immune system. And so the problem for these patients was that they would have rejection of the heart, and then they would succumb. And transplantation didn't take off until the early 1980s when cyclosporin was developed. That's the drug that we use to lower the immune system and prevent rejection. And now transplantation has become a relatively common procedure that's performed across the world.
So really, this is what started a legacy in Houston that still makes us today a worldwide medical destination. Without that medication, that first patient lived less than a year, but at that time, that was really considered amazing. That was considered a success. And we have someone in our newsroom who was also impacted by Dr. Cooley's great work. I'm going to talk to her coming up at 8 o'clock. But also, as a reminder, my dad has now lived a year and 2 months with a kidney transplant thanks to medication and innovations like this. This really propelled a lot of the transplant success that we see today.
It's just incredible
Absolutely.
the strides that we've made in this city, and how many families are really grateful for all that work.
Yeah, how many families are impacted even just by Dr. Cooley's patients, even though he's not around anymore? Right. I mean, he left such a legacy for our community that still a lot of people in our community are impacted by what he did.
Well, we'll look for you at 8 then. Haley, thanks. That's great.
We're going to get to why you don't ever want to just jump to a knee surgery, but I know that you liked the conservative option, so I'm going to repeat it for those of you. The most conservative way to eliminate and prevent knee pain is a diet with anti-inflammatory foods, exercise that can strengthen the muscles around the knee, and potentially losing weight that's adding to stress on your knee. Actually, you know, a doctor told me that this is the time of year he sees the most knee pain because of holiday weight gain.
No kidding.
And now this is the time of year when you start to feel the pain. He says it goes back in the summertime.
People are
after
getting out
like,
more
lose
too.
the weight
Spring cleaning and the other things.
Yeah, that's
starting
true.
to get moving
That's
again.
true.
I think anyway.
Anyway, sometimes those conservative options are not enough. I got details from this pickleball player about his knee surgery. Sam Torrance is on his way to the U.S. Open Pickleball Championships in April, if you can believe there's such a thing.
Oh, yeah.
But a couple months ago, that was not possible for him. Like 3 in 5 adults, Sam was suffering from knee pain. And hip and knee specialist Dr. David Doherty says they tried a variety of these conservative options first: an anti-inflammatory diet, exercise, a cortisone injection. There's also hyaluronic injections, which he says this is a newer type, and says that it's actually become really popular among his patients because it can do the same thing in your knee that it does for cosmetics. It fills in crevices that are causing the pain while also lubricating the joint. Also, you saw right there that platelet-rich plasma, or PRP, is another popular injection. Dr. Doherty says this is where you know what platelet-rich plasma is. You spin the blood, and then you take a substance on top that comes out, and it has all these like healing factors.
Oh, wow.
And you re-inject just that substance into the body, and it gives your body a super dose of healing to your knee.
No kidding.
That one takes a couple of months or possibly up to a month or more to see results, but ultimately this can take away the knee pain. And I don't want to give away who on our staff has done this, but I know somebody who got a lot of relief from doing platelet-rich plasma. Yeah. So what are the qualifications Dr. Doherty looks at to decide whether or not you actually need to go to a knee surgery and which technique to use? Hear him out.
Regardless of what the reason for your joint replacement need is, whether it's degenerative changes, an injury, or you might have an inflammatory condition that destroys your joint from an autoimmune standpoint, regardless, the treatment pathway is fairly similar. The total knee replacement umbrella encompasses a variety of different pathways where we can take a patient and look at their specific needs. We marry those needs with their anatomic considerations, and ultimately our goal is to restore function for that patient, to take away the pain that they're experiencing on a daily basis, and to give them the opportunity to get back out and do the things that not only they enjoy doing in their life, but the things they need to do. There are some patients that can have a knee replacement done with minimal resection of soft tissues and ligament preservation. And there are some patients where those ligaments are too diseased to keep in place, and so we have to do more work and then replace those with the technology within the knee replacement.
The problem with jumping to a knee replacement without trying all of those other options first is Dr. Doherty says it's not going to yield good results, because he says if you replace the joint too early, before the knee has had a lot of arthritis or before it's gotten to bone on bone, the patient's likely going to have a lot of trouble. A knee replacement is meant to relieve the pain and restore the function, but it's never going to be the same as a healthy knee. So if you still have a healthy knee, and it's somewhat comfortable with all these other options, you want to keep that healthy knee inside your body, preserve your original joints as long as you can. It's never going to be the same if you get a knee replacement. It's just if you live for years with arthritis and with pain, then those are the people, they get the knee surgery and they go, man, I wish I had done this sooner, because they get the real relief, the true relief from it.
But for other people, there's a potential to do it too soon.
Yeah.
In that sense.
Yeah, don't do that. Bad idea.
I like trying to check the diet stuff because it's tough to do, but I've personally found over the years that cutting out certain meats and sugar for sure cuts down on inflammation, and I feel a whole lot better.
Yeah, well,
but that's not always enough to do it, right? I mean, it gets you somewhere, right?
No, yeah, it's not always enough, but I mean, a lot of people who are, eating poorly will see a big result if they try to eat like leaner, cleaner, greener foods, right?
Like cut out the fast food for a month and see how you feel, and it changes things.
Definitely a good option.
I had to lay off the burgers.
And adding things that are anti-inflammatory, like turmeric, pepper, adding those spices will also help. My mom says it cured her back pain. Turmeric.
Really?
Yeah.
Yeah. See, my mom said cutting out sugar cured her knee and back or whatever it was.
Yeah, totally. Yeah, you got to take away and add. Mm-hmm.
There it is. It's interesting, the connection there. All right, Haley, thank you.
Well-balanced diet.
Yeah.
Hi guys, I am here with Patsy Gatterson. We are in Aldine and she is showing me what a volunteer driver with the American Cancer Society does. Actually, right now, they're in need of 20 drivers. So Patsy, why did you decide to sign up?
Oh, I'm driving because they were very helpful for my parents.
Both of your parents had cancer and both of them used this resource at different times.
Yes, both of my parents died of pancreatic cancer, 54 weeks apart.
What did it take for you to sign up to be a driver?
I would say maybe it took me 20 minutes to get into the program and get started, and then they do a background check, obviously.
Now it looks like we're still in Greens Point. Are you going to stick to your area or do you drive all over? How does that work?
It just depends. I just have a heart, so I'm going to do a few for MD Anderson, which is where they took my parents. Just kind of a payback, if that makes sense. So just to be able to at least take one to MD Anderson kind of thing, and if not, then maybe around the area, and just kind of what's in my area.
Jenny Todd told us earlier that it is crucial for them to have more drivers sign up and relaunch this program.
In 2022, there's going to be an estimated 139,000 more cancer diagnoses in Texas. And back in 2019, when Road to Recovery was running, we provided 752 cancer patients with 5,700 rides to treatment for free.
Can I show them what you have here?
Yes, we have a package that we, a care package. You got paper towels, and I've got gloves here. I've got my mask.
I mean, unless you've been through it, you don't realize that these are really important things to have in the car.
No, you do not. In fact, when I read it, I thought it's not just a haphazard, just go pick up somebody. No, you're ready. You can help. You can actually care for them. Sign up to help someone now before you actually need it in your family, because it's a lot easier to drive someone with a happy heart than having to drive them with a heavy heart.
And I think they need a lot more drivers just like you. And if you're interested in being a driver yourself, you can go to this article and click to Houston.com. Reporting from Greens Point, I'm Haley Hernandez, KPRC 2 News. This is a fascinating story about an Ironman athlete who passed out while competing, and it revealed he had bladder cancer. Chris Beatty said looking back, he remembers aching, even blood in his urine, but he pushed through his Ironman training. With racing on a seat for too long and running long distance, pain is expected. But in hindsight, those might have been symptoms of cancer, which was only detected after one bad race.
I sat down in a parking garage, and from there I lost consciousness.
He was diagnosed with bladder cancer and not eligible for chemotherapy.
When I asked the doctor about doing nothing at all, he said you'd be dead within a year.
Dr. Michael Brooks, a urologist at Houston Methodist West Hospital, turned to neobladder reconstruction to remove the cancer and save Chris's life.
The entire bladder and the prostate are removed, and then this whole lower urinary tract is reconstructed robotically within the body.
With robotics like this, Dr. Brooks was able to perform a very complicated surgery with a really small incision.
Every single measure, patients are doing better now. For him, the surgery was done entirely robotically with tiny incisions, reconstructed the whole bladder and lower urinary tract to allow him the quickest recovery, highest quality of life right away after the procedure.
Very interesting. I had no clue that they could do that.
Chris's recovery is astounding. His current scans show zero cancer, and he's already training for his next triathlon.
There's no detectable cancer in me right now, and they're going to continue to monitor it, have images every 3 months, and then after 2 years, I believe it's every 6 months. So, looking forward to being cancer-free.
This type of surgery has been around for a while. However, it's remarkable now because more recent studies show that the robotic method leads to a lot more success in patients. So even though neobladder surgery was always an option, it's now a better option than it used to be because of those robots. Houston Methodist West is one of the only hospitals doing this outside of the medical center. I'm health reporter Haley Hernandez, KPRC 2 News.